Well, the cost of health care keeps going up, and healthy or not, it is affecting all of us. Tonight, Tiffany Tarpley takes a look at the challenges and how advocates are pushing for change.
There we go.
As an athlete, Susan Rostkowski is used to a challenge, but navigating the healthcare system as a cancer survivor is a sport unlike any other.
It's a very hard game to play. It's hard to figure out what piece to move where.
Emotionally, physically, and financially.
Thousands of dollars of doctor's bills that are now just compiling on top of each other. Where do you even start to dig out of that?
According to Centers for Medicare and Medicaid Services, or CMS.gov, U.S. healthcare spending grew 9.7% in 2020, reaching $4.1 trillion, or more than $12,000 per person.
Only in healthcare have we been blind to no prices, oftentimes blindsided by outrageously overcharged medical bills, and then expected to pay with a blank check.
PatientRightsAdvocate.org founder and chairman Cynthia Fisher says when people know prices, they can compare and save money, even in healthcare. In fact, hospital price transparency is mandatory. Starting January 1st of last year, each hospital in the U.S. was required to provide clear, accessible pricing information online. One of the ways included a display of shoppable services in a consumer-friendly format.
Like Expedia or Kayak or Google Flights did for airlines, consumers are soon going to be able to find, well, what is an MRI? And if I want to get one in 48 hours, where can I get one and at what price?
But it's not that easy, at least not yet. In February, PatientRightsAdvocates.org completed a study and found only 14.3% of 1,000 hospitals surveyed complied in all aspects of this federal transparency rule.
The first step to make the things affordable. And
Bowling Green State University public health professor Dr. Gina Lee believes eventually patients will choose hospitals that are more open with information. It could also help level the playing field when it comes to care. Initially, price comparisons weren't a priority for Susan.
When you're just trying to survive a surgery or even just survive day by day, even just to get out of bed, I'm not going to look line item at a bill that I'm getting.
She was diagnosed with breast cancer in September of 2019. Susan took aggressive steps, a double mastectomy and hysterectomy to prevent the cancer from returning. But there were also complications, more surgeries, procedures, and doctor's visits. Then, 1 year after that initial diagnosis, she learned the breast cancer spread to her spine, metastatic, stage 4.
I will have cancer spreading throughout my body the remainder of my life.
With the help of PatientRightsAdvocate.org, we looked into one of Susan's procedures. As an example, area hospitals are billing at $1,712 for it. Her insurance paid about $707. But if she chose to pay the discounted cash price, that $1,700 procedure could be as little as $211 in some cases.
And so once we have this power to see these prices, it's going to take all of us to stand up and refuse to be overcharged.
Susan says after getting over the shock of incurable cancer, she's starting to focus more and help others.
Advocacy is the number one thing. It is so important to advocate for yourself.
I reached out to CMS, which is under the U.S. Department of Health and Human Services. So far, no hospitals have been fined for not complying with this rule. A spokesperson says that's because they've either corrected or are working to correct the issue. For what's happening at local hospitals and for a link to Susan's GoFundMe, check out this story on our website. Tiffany Tarpley, WTOL 11.